Today, I'd like to have Dick Phoebus come up here. Dick is a member of the Rotary Club of the Villages, and he will introduce our guest speaker. So, Dick?
Thank you, Dave. Yes, I'm from the Rotary Club of the Villages. I picked that up here. I moved to the Villages back in 2012. In 2013, I was elected president of the club because they couldn't find anybody else. You know how that works sometimes. And a few weeks after that, I was at a conference at the Rotary Center on downtown here somewhere. And a young lady came up behind me after the meeting and said, "You're the new president of the club, you're going to sponsor our first global grant." And I didn't even know who this young lady was. So I said, "Sure, we'll do that." Well, I didn't know what we're getting into. At this point, our club has sponsored 4 grants, 12 trips for cleft lip and cleft, and you all have helped us along the way with DDF and some other assistance. So I'm going to introduce to you today Ruth Bowling. Ruth Bowling is a development officer for Sharing Smiles, which is a component of Advent Health Services Foundation. Ruth not only sells the program and raises money for the program, her heart is in the program. Ruth is a college graduate, she's a grandmother. What else do you need to know? Ruth Bowling.
Thank you, Dick.
Oh, thank you so much for the opportunity.
Thank you so much for the opportunity to speak to you today about Rotary's partnership with Advent
Our mission
Health.
programs began back in the
90s when the president of what was Florida Hospital looked around the world and saw all of these medical missions going on. And he thought, well, you know, we're faith-based, we're healthcare, we should be able to do this. So we got a bunch of doctors and nurses together and we said, hey, who wants free healthcare? Well, when you offer free healthcare, particularly to less developed countries, you get lots and lots of takers. So for the first 5 or 10 years, we went anywhere we could get an invitation. Tanzania, Russia, before that crazy guy took over. And we would just kind of parachute in and do our thing and leave. We did really good things, but over time we decided we really wanted to find a way to make things more sustainable and measurable. So there was a gentleman who served on our foundation board of directors who was a member of the local Rotary Club. And he said to us, have you thought about partnering with Rotary? We said, well, no, we haven't. Oh, he said, you really should. He was so right. Rotary has done for Advent Health what Advent Health with our 90,000 employees couldn't do for itself. And that's to have a long-term sustainable medical mission trips that are having impact on lives of children and families around the world. So like Dick said, one of the first projects that we worked on together was a cleft lip and palate project. And our board member, who had run USAID in Mexico and was a Rotarian, reached out to his friends in Mexico and said, well, what do you need? And they told him, we have a lot of children born with a cleft lip or cleft palate. And unlike here in the United States, if you don't have money to fix that in the United States, we have Medicaid. Not every country can afford to do that. So Dick and I put together this project, and your club and a number of other clubs banded together to work on this program. And Dick was kind enough to make a video for us. So let me just show you where your money has gone.
Arrival on the first day is always kind of exciting because the local Rotary clubs have kind of prepared the community. We arrive at a hospital and there may be 50 or 60 kids plus 50 or 60 moms and dads and grandmoms and siblings waiting for us anxiously because they know this is an opportunity to change the life of their kids.
I am Wilbur Davis. I'm an oral and maxillofacial surgeon. Sharing Smiles has a cleft and lip and palate team, a pediatric dental team, and physical therapy team. It's helping one child at a time.
Hi, my name is Kimberly Lawton-Kuhn. I am a board member with Sharing Smiles. Check-in day was incredible, just to meet all the families and to see the need that was there. been on surgery day just to see the partnership that happens between the doctors here in Mexico and our doctors in the US, just the collaboration in surgery, out of surgery, just the teaching and the collaboration was probably my favorite part.
There's a thing in Rotary called your Rotary moment. And at one time, usually in a person's Rotary life or career, there's something that really hits them to say that what we're doing is really worthwhile. And it happened on my first cleft lip and cleft palate visit when I saw those kids, and a day later I saw the work that the surgeons had done and knew in my heart that their life was immediately changed.
So we are sharing smiles, but we are doing it with you. And so, Dick, thank you so much for that. All right, so Rotary partnerships with Advent Health. So here's our purpose. We used to be called Florida Hospital, where Advent Health now engages in global mission work because our mission is to extend the healing ministry of Christ. So through our 2 mission programs, we deliver healing and hope through quality healthcare, education, and training. And we do that with our host country providers and Rotary clubs to build a sustainable legacy. What makes us different? We're committed to long-term success. We focus on training and we focus on partnerships to help build a lasting legacy, because anybody can parachute in and do their stuff. These are some of the countries we work in. We will be adding a few more this year. And Dick and I did our first one in Peru. So cleft lip and palate, we run 6 trips a year, 175 to 200 children. We have Rotary partnerships. Now, Dick and I have worked in Cochabamba, Bolivia, Tarapoto, Peru, Villahermosa, Mexico. So he's led trips in all those areas and grants. And then Winter Park has led Merida. And then there's a club in DeLand now leading Campeche. So, I don't know if you saw that, but that's the little girl, Nasa, before she met Rotary. And then this is her today. So physical therapy, we do 2 trips a year, 3 trips a year actually, and we care for 35 children. And we are working with the mustard seed communities. And so you can see that particularly children who are handicapped, if you put a child in a wheelchair and you don't move their muscles for a long time, that's what they end up with. Their muscles end up contracted. So our goal there is to be in charge of the physical therapy program so that when these mission trips come down, they have a guideline to follow, so they don't just keep reinventing the wheel. Pediatric dentistry, 4 to 5 trips per year, 400 to 500 children are treated. So we have a partnership in El Hogar, which is in Honduras, and we work, I don't know if any of you know Dr. John Bishop. He's a dentist who now comes and volunteers with us. Dr. Wilbur Davis, I don't know how many of you remember him, but he's also here in oral surgery. And then Dr. Roger Knopfsinger. So those are our leads. Haiti Adventist Hospital, we are working on a water project there with the Rotary Club of Passionville. We are meeting with them on Monday to try to pivot from digging a well to buying an armored ambulance, because that's what's needed right now. I mean, I kid you not. So hopefully that will work out. Clínica Adventista in Iquitos, Peru. We just completed last year an oxygen generating project. These were all global grants that Rotary has had the privilege of working with Rotary clubs on. So this was the Rotary Club of Bonita Beach Sunset, and then a Rotary Club in Iquitos, Peru. When the pandemic hit, so Peru's at a really high elevation, their healthcare system was totally overwhelmed. So patients, the black market for oxygen was ridiculous. And how important is oxygen? Well, I mean, hold your breath and think about it, right? So Rotary helped us, and we were able to get on a ship, you see that ship there, brought over an oxygen generating machine, and it was installed there. And now at that hospital there, that in Iquitos, Peru, they are taking care of the whole community with needs for oxygen. So we're grateful for that. Kalala Learning Village, which is outside Addis Ababa, Ethiopia. We are currently, and again, a lot of these grants have been with your support, we completed a high school there, and now we are working on getting computers because they don't have computers that are connected to the internet. And so Rotary has stepped up, the Rotary Club there as well. Rotary provides recovery books. This is the Hope and Healing Center in Sanford. And your club and a number of other clubs provided their district designated funds for this level 2 inpatient, outpatient opioid and other substance abuse recovery center. And this is in partnership with the Seminole County Sheriff's Office. And it's amazing, the cure rate, if you will, is over 90%, which is almost 3 times the national average. And it has been recognized by our current administration, believe it or not, even though it's in partnership with Seminole County, but and they're fixing to do even more with that. So we thank you for that. Through Dick's Club, we did a global grant in Eustis, Florida, community-free clinic for very low-income patients who have diabetes, type 2 diabetes, and who had to choose between getting their medicines and their testing trip and food. Dick stepped up, and we did a global grant when Barry Gaynor was president, and we were able to provide those testing strips and those starter medications. Rotary supported Advent Health during COVID-19. You reached out to us during COVID-19 and said, what did you need? What do you need? And at first we needed ventilators. Everybody needed ventilators. But by the time we had all the money together, here's what they needed. You see that little toaster oven there? That is a sterilizer. That's a special sterilizer where when you put your phone or your iPad in there, it sterilizes it. So we had to bring those into the patient rooms so they could say goodbye to their families during COVID-19 because we could not allow visitors in there. At the time, we didn't know what was causing it. We had no vaccines, but you provided that opportunity. And then you see that little black thing with the wheels. That's a hydrogen peroxide sterilizer. It runs like a little remote control, and we brought that into patient rooms that had left after COVID-19, and we sterilized the entire room, killed all the virus. We were able, when we didn't have enough gloves and gowns and masks, we could put those on shelves and use your sterilizing machine that you paid for to re-sterilize PPE. So we didn't run out of gloves, we didn't run out of anything. And that's what you did for us. You reached out to us to do that. We have a new partnership with Rotary through the lady who's our zone coordinator for Rotary, a CT scanner for a hospital in Nepal. This hospital is right on a major highway and they have no CT scanner. And so we are partnering with them. This is one of our partner hospitals in Nepal. And so we're working on a global grant. You'll be hearing about that once we get our grant number to provide a CT scanner. Because if you're in an accident and you've got to go 45 minutes to the closest hospital, that's a problem to get a CT scanner. So this is the Shear Memorial Hospital. And the gentleman here who is the president of the hospital was the president of his Rotary Club. He's in Nepal now, but he was in the Philippines. So he's already got 6 Rotary clubs on board. He's got the mayor, the governor. I mean, he's got all kinds of partnerships together who have visited the hospital. And that's the plan. Then while I was minding my business in Houston, who do I meet up with? By RI Director Haresh. And he says, what countries do you work in? And I told him Jamaica. Oh, my cousin's the president. Let me call her. Oh, where's your hospital? Oh, okay. Hey, we want to do a project with your hospital. It's amazing. Everywhere we go to do good in the world, y'all are already there. So it's a pretty neat hospital. Rotary partners in Mexico. And again, you know Mr. Phoebus there. And then that's Fred Roby. So they are both members of the Arch Clump Society, which if you're unfamiliar, that means each of them have made a personal contribution to the Rotary Foundation of at least $250,000. That's incredible support from the Rotary Foundation. Rotary partners in Peru, 15 members in that club. We've been working there 10 years. We were able to fund a scholarship for our volunteer dentist to become an oral surgeon. And just 2 weeks ago, we did a trip there to Tarapoto, Peru, and that oral surgeon now is able to do palate surgeries to repair the holes in the roof of these children's mouths. He was always a dentist, but now we were able, so we covered the scholarship, but you covered everything else, and that's incredible with those kids. This is Paul Farino. He's Dick's friend up there in the villages. Full colonel, retired from the Army, took care of President Reagan back in the day. He came on the trip just to volunteer, but we had a couple nurses decided to drink the water. Bad idea. Latin America, they had Paul out of that OR quite quickly, and Paul took over the whole thing, ran the whole recovery room. Now the guy's old, lives in the villages, supposed to be playing golf, and he's very patriotic, but he will tell you that caring for our president paled in comparison to this Rotary experience. And this is his little buddy. He calls him his little George Foreman, so cute. And there he is in the recovery room. So, and he always brings all kinds of toys and crayons. You've never seen kids so happy for crayons as in Latin America. They call him Dr. Paul. You know, they're always asking for him. So the partnership, you see there, they've lined up all the cases. And now our doctors have lined them up, and we've screened the children with their doctors. So this is how the vocational training team works through Rotary. Our doctor says to their doctor, okay, how are we doing this? Which cases are you operating on? Which ones am I operating on? Which ones are we doing together? So for the purposes of Rotary, this is called a vocational training team. Our doctor is there in the white. Next to him in the blue shirt is Dr. Guerrero, that's the dentist, who's now become the oral surgeon. He's from Peru. Next to him is Dr. Eligio Arceniega. He is from Bolivia. So we have this whole multidisciplinary team working together. I mean, again, Paul is running that entire recovery room. These babies will never do anything to him or for him, but why does he do it? Because he's a Rotarian, that's why. And so it does take a big team to work together. This 21-year-old young man had cleft lip and cleft palate, redid his surgery. And the first thing he said is, yes, now I can have a girlfriend. We're like, really? He's 21. He's thinking what every other 21-year-old young man is thinking. I want a girlfriend. But his mother cannot contain her emotion. This is her son. This is what keeps her heart beating every single day. What do you think this mother thinks about Rotary? Do we need to go show her the 4-way test? Oh no, my friends, she knows. She knows today, her whole village will know tomorrow, and for the rest of her boy's life, as she looks at that beautiful healed face, there is one name she will remember, one name. That name is Rotary. For the purposes of a Rotary Global Grant, it is very important that the host club, whatever club is hosting you in their country, work very closely with the international club. These grants have a lot of paperwork, and if it weren't for Dick Phoebus, we would not get that done. It's very important to work together in partnership. The first time I went on one of these trips, we screened 90 children, but we could only operate on 45. And I had to look in the faces of those 45 parents while we said to them, we can't help your baby this year. But because of John Stein and the generosity of Rotarians in this club, we don't do that anymore. Do you see all those supplies and equipment? Global grant, vocational training team. When the funds that you give every year to the annual fund come back to the district and you get your DDF, district designated funds, and your president, Mr. Joyce, signs that over to the grant, the Rotary Foundation matches those funds 80 cents on the dollar. How far do you think an American dollar goes in Bolivia or Peru or Mexico? My friends, that's a lot of smilage. Those are all those supplies and equipment, and what we didn't use, we left behind, and what we left behind got used the next day and the next day and the next month until we came back. That, my friends, is the spirit of Rotary. This is Ana Yoselin. She was 9 months old. When we met her, her mother, Guillermina, was 17. Dad took off. Many of these children are abandoned. They just think it's very shameful to, that these are demon-possessed children, so they leave. Grandma has found a syringe and taken out the needle and is pushing milk into the back of the baby's throat because, yes, they need plastic surgery, but it's not like my ears are sticking out a little much. This is, I'm an infant and I'm trying to nourish myself by sucking on a nipple, but there's a hole in the roof of my mouth. So trying to even be heavy enough for us to come and do surgery for them. So we screened her very carefully because she's a tiny little thing. Grandma loves her grandbaby. All grandmas do. Society won't accept that child. This is a long and complex operation, and unlike down the street at Advent Health, where we have a neonatal intensive care unit, this hospital serves the poorest of the poor. They got the technology of 1950, 1955, and if you go a little over or a little under on the anesthesia, that child is toast. You do not want to end up with a dead child. Not in Mexico, not in Peru, not in none of those places. Not here, but it's real bad over there. But the operation is a success, and the doctors are so excited with the result. Grandma can't help herself. She hugs the doctor, but the parents don't do that. When you hand them back their kid, they go, because they think you've switched to their child. They look, that literally they don't know what to do. And then after about 30 seconds, they just burst into tears because this is her little girl. She can grow up and have a quinceañera and have a normal life, get married. And you know, I don't speak Spanish like un poquito, but I know what every mom and dad and grandma and grandpa wants for their little one. And that's just to have a normal life. So now we have a whole healed family. And she came back to visit us. You did this, you Rotarians. You saved that baby's life. You saved that baby's life. Everybody in her family, everybody in her village, everybody they meet, they know exactly what Rotary is all about. Rotary partnerships, Rotary spirit, Rotary power. That, my friends, is Rotary. Rotary and Florida Hospital, now Advent Health, working together to heal children because we're there 1 week out of the year. Who do you think brings those children for their follow-up visits? It's not us, it's you. Who do you think works with the local government to say, you want to get elected next year? To make sure that that government hospital accepts those children for their follow-up? It's not us, it's you, right? Who do you think works with the local politicians? Not us. We can't even get our own stuff together here. It's not us, it's you. Partnering to heal children and provide hope. So yes, it's Rotary clubs, locally, internationally, it's the hospital, it's the Ministry of Health, it's the university, it's all those partnerships together. And so we say thank you, Rotary partnerships. Why? Whoops. Why do we say thank you? Because Rotary changes children forever. Can you say that with me? Rotary changes children forever. One more time, I'd love to hear it. Rotary changes children forever. Thank you. So on behalf of Jesus Adrian, the soul guy, and all the other children like him, I promised, Dick and I promised the parents that we would come here today and we would say, thank you so much for what you have done. You are their heroes. So when you look in the mirror today, I want you to see what we see. We see heroes. We see people, when they see a face like this, you don't say, man, that is too bad. Hey, honey, hand me another beer out of the fridge. No, you say, we are Rotarians. This is our area of focus and we can fix this. And you give to the Rotary Foundation. And these little children will never be the same again. So if you wonder, why does your president, David, bug you to give to the foundation? Just to bug you? No, he knows the impact that your generosity to the Rotary Foundation has on lives around the world. So thank you for what you've done. You're their heroes. The end. So, thanks. Thank you. So I know that you have questions and Dick has answers. So we're going to see if they, let's see if they match. Come on, Dick, you come up here, answer the questions.
Let me mention the boy that young man who's 20 years old. I'm sorry. The young boy you saw in the bed, and he was 20 years old, and he was happy about being able to have a girlfriend. But you can realize that these children have no life at all if they're not corrected. This boy had, as I understand it, had to go through 9 operations before he got into the condition that he was in that bed when you saw him. Yes, sir, in the back.
We got any questions?
Okay, so I have excess PPE, and I know that Advent Health has access to PPE, but I have access, and it's taking up a big expense in my warehouse. Okay, so.
Got it. I love it. Thank you. Okay, Denny's got a question. Hold on. There's a question, right, Denny? Huh?
I told you that Ruth would put on the best Rotary advertisement if you so. Ruth, how many clubs are you an honorary member of? Ruth, how many clubs are you an honorary member? I know you're a member of ours and also the Villages. Anybody else? 4 clubs. Obviously worth it. Isn't she absolutely amazing? Can you have a better advocate for Rotary?
Ruth, I had just asked Ruth one thing. And I think it was in about 2009, I believe, we sponsored a program in Tarapoto. One of the pictures that you saw there today was one of those children whose life was saved. So thank you, Ruth, for all that you did.
Ruth, you got a question on the other side of the room. Let me get over there.
Ruth, I can just say it. It was at least 10 years ago, maybe 12 years ago, when I was president of the Orlando Evening Club, and you came, and we got together, I think, the first grant in this district that went to cleft palate, which was an unusual thing, but the feedback that you gave us the following year was wonderful. And to hear what you've done today, applaud to you. What a great presentation.
Okay.
Any more?
Ruth, thanks for your presentation. Thanks for leading us.
Yeah.
Thank
Ruth,
you.
Ruth, could I ask you to come up here, please? This is a small token of our appreciation. Thank you very much for this. This is, so that you remember us. Thank you. Let's hear it one more time for Ruth Bowling.
And 2 more times for Rosie. 2 more times for Rosie.
All right, thank you. Thank you very